And now Jagriti Dave is joining us live from Washington, D.C. for more updates. Jagriti, thank you so much for joining us. So tell us some alarming statistics being quoted by Dr. Fauci about the expected scale of coronavirus in the U.S. So what is the government doing as of now to tackle this? As we know, social distancing guidelines seem to have been extended till April the 30th.
Well, indeed, that is one of the major announcements that's come out of this White House briefing this Sunday evening. Dr. Anthony Fauci, he is the country's top expert on infectious diseases, and he spoke on CNN saying that between 100,000 to 200,000 Americans could die as a result of the coronavirus pandemic. And President Trump had previously suggested that the American economy could reopen by April the 12th. By Easter, he said. But today he said that that was merely an aspiration, and that it was clearly necessary to continue with the social distancing guidelines, which he's announced are to be extended in the United States until April the 30th.
Right, and we also know that the US is now emerging as the new epicenter for this virus, and many are cautioning that the government needs to act faster to avoid going the Italy way, as they say. And we're hearing about shortage of protective medical equipment and ventilators. So what measures are being taken currently to tackle all these issues?
Well, the president announced that there was a stepping up of the productions of medical equipment like ventilators. So he had invoked the Defence Powers Act a few weeks ago, and there was criticisms of the president that he had not used those powers to pressure private companies to produce much-needed emergency supplies. But that seems to be happening. There's a partnership, public-private partnerships going on with many logistical supply chains, many of those companies heads of those companies were at this White House press briefing to reassure the public that they were involved and they were trying their best to ensure that supplies were reaching those areas that were needed, like New York, the state of New York, which is the epicenter in the United States. And half of the cases in New York, the state, are in New York City. There are over 59,000 cases in New York State alone, and the surge in cases has meant that there has been an issue with supplies reaching medical professionals, that they don't have enough supplies. That is the issue. Critical equipment like ventilators. And as you said in your introduction, cities like New Orleans are expected to be seeing a similar spike in cases as we have seen in New York, and the potential shortage of ventilators, etc., in other states like that.
Right, and you know, as I just mentioned, the social distancing guidelines for the entire country seem to have been extended till April the 30th now. So what does this say about tackling measures being taken on ground, and are people actually following these social distancing guidelines on ground?
Well, it seems that people are, in general, there is a sense that this is being taken seriously. Many people across the whole of the United States are enacting the guidelines. I mean, several states, they have implemented their own measures. Social distancing and lockdowns mean different things in different states. So in some states, there are tighter restrictions on how people can go about their business. I mean, essential businesses are the only ones that are open in several states. Non-essential businesses, like gyms, places where people congregate, have been shut down in many places across the United States. Many businesses have been forced to close down. So many people are working from home or are waiting this out at home. And so there is a real impetus. The president did say that it is important for people to maintain social distancing guidelines over the next few weeks, because he did say that the peak in death rates is likely to happen over the next 2 weeks. So they are critical. And there's indications across the planet, across the world, that people are maintaining social distancing guidelines, that they are having a positive effect. Right. And if the government were to do nothing, if nothing were to happen, some studies suggest that the number of deaths in America could be as high as 2.2 million people. So there's a clear incentive for people to follow these guidelines.
Right, Jagriti, thank you so much for joining us and for all your inputs. And now let's move on. The COVID-19